So hi everyone, my name is HENNESYS from ArmHug, and I've got a really great guest for you today. His name is Jovon Harley. He has been in the medical field for over 25 years, currently an executive for an innovative laboratory company in Atlanta. He's mentored and helped hundreds of phlebotomists start, restore, or improve their mobile phlebotomy businesses. And today they are developing a mobile solution to help phlebotomists expand their career opportunities. So Jovon, take it away. Tell us, how did this all start?
Thank you, HENNESYS. I appreciate you providing this opportunity and really talking about this subject. I have been, again, working in the mobile phlebotomy field specifically for over about 12 years, the medical field for over 20 plus years. I started my journey in the military as a combat medic. I went to several different tours, and like most of the base that you have tons of skill, but you try to narrow down on the civilian side what skill you want to use. And so I went through several iterations of emergency room technician, nursing, started my journey towards physician assistant school, and saw that my IV and phlebotomy skill set was really sought after. And so I started to do a little bit more research into phlebotomy in general, and found a couple of agencies to work at. I kind of use it as a little recon, right? So I like to go into companies and see how things tick, and make adjustments so that I can add value to the places that I went to. So I worked for LabCorp, I worked for several other laboratories, I worked for Quest, went from different levels, from your office phlebotomist to your supervisor manager level, doing training, doing other iterations, onboarding, acquisition. So I went through the gambit of mobile phlebotomy and phlebotomy in general. So fast forward, progressed, but coming up with a plan to streamline our efforts and make ourselves known as a link in the chain of healthcare.
Yeah. And how would patients find you, or how do mobile phlebotomists would find you today?
So I'm on LinkedIn. That is going to be my strong suit right now. I've have some other companies that I do run and work with through some work that I've done prior to starting with my new company here is the Lab Genius. So you can reach out through me in those areas, but I try to make myself available because working with mobile phlebotomists across the nation and other countries, I realize, like we talked about, that there is some misinformation and just not some clarification on where we should start.
Okay.
And if you are listening to me today and you're at a Quest or you're at a LabCorp and you're thinking about migrating away from that, then I would encourage you to do three things. And those who I've mentored know those three things because I drill it into them, which was to create a plan. A lot of times we think that getting out here and starting a mobile phlebotomy business is easy. I can tell you it's not. In respect to finding clients, creating a system, having structure, those are the things that I'm talking about. Sure, you could get out here and find a client or two to draw blood on, but how do you create a good foundation to make it thrive? The second thing is to create a budget. The budget is where you will decide if you need equipment, if you need supplies, if you need a location, things like that. We get far away from, and we're in the midst of doing it, and we realize my car broke down, or we realize that I don't have that consistent income, so I go back to the job. And creating a budget, a 6 month to even a year plan is what I strongly recommend. And then lastly is to set a date. When you don't set a date, when you don't when you plan to succeed, but you don't have a date, you end up reverting back to, well, I'll just do it next year, or I'll do it another year, or I'll wait. And you realize that, man, it's been 2 years since I set this goal of leaving the job, and I haven't even started with writing down the vision and the plan. So, and then one caveat to setting a date is to stick to it. So as much as you want to set that date of, let's say, January 1st, you got to stick to it, right? I say it's okay to go back to the job, but make a commitment to yourself to commit to what you want to do.
Yeah, that's great advice. I think that sometimes we get so kind of stuck in our heads and we start thinking like what we're going to do it, but if we don't have that push or that motivation or that right person next to us to tell us, make that move,
Right.
that's going to be
Yeah.
really important.
Yeah.
And so how many
That's
mentor now?
I mentor on a regular basis, right? I mentor through continuous engagement. I mentor through answering questions for just various needs. So I mentor, I would say, on a consistent basis. Um, I would say it was 100. I'm sure it's more. I'm sorry. It's getting some calls in, but yeah, I would say it was more every day. But again, the main focus is to provide a streamline of good information and resources for phlebotomists.
Yeah. And to your point, like one of the reasons why we started doing this YouTube channel and reaching out to people to talk about phlebotomy and the industry is because a lot of the companies will probably fail, right? You'll start it and they probably will say, hey, this isn't what I thought it would be,
Hmm.
or this isn't going the way I planned. Maybe this isn't
Hmm.
for me. So thank
Right.
you for pointing that out, that you need a plan to start. So
Yeah.
super important. You need like templates now.
Yeah. Yeah.
So with the companies that you're working with, like what's something that you keep seeing that you wish you could have, I guess, told them earlier, that's something that they could have avoided?
Setting realistic expectations. I think we set some unrealistic expectations that, I'm going to make all this money, and the money has been a strong factor for moving out because they may not be happy where they are on job wise. But I believe that shouldn't be your focal point, right? Because you're going to come to the same situation that you find at your job is like, do I really want to do this every day? Do I want to get in my car? Do I want to get up at 3 a.m. and go to that nursing home? Do I want to drive 2 hours to see that patient? So setting realistic expectations first will allow you to um, go in the right direction.
Yeah, thank you for the honesty. That's great. And then something that I sometimes hear a lot about is people graduating, and I think you made a comment about this, and thinking that mobile is their first position or their first option. Maybe
Well, yeah,
phlebotomy
let's
in other locations might be different. So curious to
yeah
know.
let's unpack that. And if you really think about it, in certain locations, you may have a introductory area where they place you at. But as a brand new phlebotomist, I get out of school. Let's say I went through a full iteration of maybe like a college. I did 16 weeks, right? I did some hands-on. I was at the top of my class. I get out in the field. I'm with a patient, and real life experience needs to be applied. And how do I triage that patient so that I'm not sticking them multiple times, and I'm not sweating or being, uncomfortable, or, all the things of being nervous in that situation happens. And so I'm representing not only the company, but myself. So the next time I may have to go out and see that patient, am I doing myself and the company justice by not having a more seasoned person to come along with me and provide guidance and good suggestions on how to do different approaches. And it's not just about drawing the blood. You could do excellent in that, but what about the customer service part of it? What about the follow-up? What about organization? Those things are not talked about in doing mobile phlebotomy, and you need to have all those aspects.
Yeah, definitely. It's like it's more than just drawing blood, right? Which people
Yeah.
I've heard again and again, they feel like they're not being appreciated.
And I hear that, but one of the things that it concerns me on different medical levels is that we're just a phlebotomist. You're not just a phlebotomist, right? You are a phlebotomist, but you're not just a phlebotomist, right? So a lot of these people are mothers, fathers, teachers in their own right, people who are making impacts into the community. So I don't like that term that we're just anything, right? So when we posture ourselves as just that one thing, that's how they treat us. And unfortunately, phlebotomists have been labeled at the bottom of the kind of like the food chain. And I mentioned on a post the other day, what about the phlebotomy heroes, right? We talk about nurses and doctors. What about the phlebotomy heroes, the ones that are doing a lot of the COVID swabs out there, right? The ones that are capturing vital blood in the right place and technique so that the doctors and nurses can do their job in a more efficient way, right? You think about the blood is one of the first things that a physician will ask for when assessing a patient. A lot of my physician friends have went to phlebotomy school. They understand the importance of the blood. So without that vital skill, a lot of things couldn't be done.
Yeah. And you mentioned going and thinking about phlebotomy as more than just phlebotomy. So how do
Mhm.
people you think, like, how would you help someone build their confidence and learn a little bit more, not just like get more training? There's so much more training. Like you mentioned
Mhm.
COVID swab testing. I just had someone ask me the other day that where they can find some phlebotomists to do some COVID swab testing for an employer in California.
Mhm.
So in case they're
Mhm.
listening, like where do they find a phlebotomist? Because they're all on Facebook groups.
Yeah,
And
yeah,
where you would find them, right?
yeah. So I know some great companies out there that really source out and vet really good phlebotomists, and I'll be happy to say that Phleb Finders, Becky Seeley is the president, or she used to be the president, but she's the owner, and she does a great job with connecting with phlebotomists. I would say definitely my company, the Lab Genius, does a great job in bringing on phlebotomists, but adding value. We have built in the ability to increase your skill set, right? The phlebotomy and the healthcare system is changing. Your designation may not always be the same, right? We have some people who have medical assistant background, who have military background, who have other backgrounds that can add value to that skill set. They're just choosing to utilize their phlebotomy skill as their mainstay. So that's how I would encourage them, is to seek out companies like mine to allow us to undergird you and provide you resources and guidance.
Great. Well, I will definitely connect you to. So last question here. Any advice that you have for people who are just starting?
Do your research, right? Understand what the laboratory industry is. It's not just where you work, right? It's not just the hospital. It's not just LabCorp or Quest. Actually, it's a fact that Quest and LabCorp have about 45% of the market share as a whole of the laboratory industry. So you think because they're so big that they're taking up 100% of the market share, it's just those two, but that's far from true, right? And I've talked to Steve Rakowski on a conference. I mean, I was at a conference and I spoke to him about just the equity within the company and the value that his own and phlebotomists have, and they they need to do some more work, right? And connecting and seeing how phlebotomists can help them revolutionize their company and the healthcare industry as a whole. Um, this is why these conversations are important, even though I sit amongst executives and I'm in spaces that a lot of phlebotomists may or may not be in at this stage of their career. But it's good to connect back where you can see that this is a destination that you can get to.
Definitely, definitely. Well, thank you so much for taking out some time today to talk with us and just share some advice. This has been really incredible getting to know you and what you guys are doing at OutLab. So I will include all your information down below this video so that people can connect directly with you and see if you're the right fit for your services. So thank you again, and I will definitely be in touch. So we'll stay connected.
Thank you again, Nancy.